Look, forget everything you think you know about a simple chest infection. This isn't just a basic medical condition. What we're actually talking about is a gripping, high-stakes thriller happening right this very second, deep inside the human body. We are looking at a microscopic war fought across millions of tiny battlefields where your immune system is fighting desperately for your survival. Picture a perfectly normal Monday morning. 35-year-old Michael wakes up with a mild sore throat. He thinks, it's just another cold, so he pushes through and heads into work anyway. By evening, he's feeling a bit run down and a slight cough kicks in. To Michael, it's nothing unusual. But what Michael absolutely doesn't know is that deep inside his chest, a silent bacterial invasion has already begun. To see how this invasion goes down, we have to track the exact journey of the enemy. Every single time Michael takes a breath, air travels through this highly structured pathway. It goes in through the nose, down the trachea, into the bronchi, splitting into smaller and smaller bronchioles, until it finally hits its destination, these tiny microscopic air sacs called alveoli. But today, Michael inhaled droplets carrying bacteria. Maybe a totally separate virus damaged his airway first, kind of clearing the path. But either way, these microorganisms have completely bypassed his body's early defenses. They've descended all the way down into those delicate, vulnerable alveoli. Now, to put this into perspective, think about the sheer, unimaginable scale of this environment. There are around 300 million of these alveoli inside your lungs. Think of them as millions of tiny balloons, and every single one is wrapped by an equally tiny network of blood vessels. Their walls are incredibly thin, literally so thin that oxygen crosses right into the bloodstream in a fraction of a second, while carbon dioxide moves the exact opposite way. This lightning-fast exchange happens with every breath you take, without you ever even noticing. Until now. Section 1, the first cells to notice. Because you see, these air sacs aren't entirely undefended. Inside the alveoli, we have these quiet little housekeepers, immune cells called macrophages. They discover the bacterial threat, and the alarm sounds immediately. They start pumping out these chemical messengers. Think of these messengers as a desperate emergency radio call, screaming, "Intruders detected." Within minutes, nearby blood vessels respond. They widen to allow more blood to flow in, and their walls actually become leaky. This whole process is what we call inflammation, and it is absolutely crucial to understand this. Inflammation here is not the disease. Inflammation is exactly how the body calls for reinforcements. And within moments, the cavalry arrives. Millions of neutrophils leave the bloodstream, squeeze right between those leaky blood vessel walls, and pour into the infected alveoli. Soon, these tiny air sacs that were perfectly designed to hold nothing but fresh air become completely jammed with soldiers. The battle kicks off, and these neutrophils attack aggressively. They release toxic chemicals, enzymes, reactive oxygen molecules. Their one and only mission is to destroy the bacteria. But here's the thing about war. There's always collateral damage, and the aftermath of this microscopic combat is devastating. The bacteria die, sure, but so do a massive number of neutrophils. The battlefield is just left littered with dead bacteria, dead immune cells, damaged lung cells, and this protein-rich inflammatory fluid. When you mix all of this cellular wreckage together, it forms that thick, murky substance we call pus. Imagine trying to blow up a balloon, but first, you fill it with muddy water. Literally impossible, right? Well, that is exactly what is happening to Michael's alveoli right now. Instead of a healthy alveolus filling with fresh air for that lightning-fast oxygen exchange we talked about, the infected alveolus is flooded with muddy pus. The air sac that once exchanged oxygen effortlessly can absolutely no longer do its job. The oxygen is physically blocked from getting through. So Michael is still breathing, and air is still reaching many parts of his lungs. But because those infected alveoli are completely flooded, the oxygen just cannot cross that fluid the way it easily crosses air. Blood is passing right by these air sacs without collecting nearly enough oxygen. Doctors call this crisis hypoxemia. And it happens not because there isn't enough oxygen in the room, but because the lungs simply can no longer transfer it efficiently into the blood. Section 2, collateral damage. Let's zoom back out and look at the whole body's response to this crisis. First off, you might be wondering, why on earth does Michael start breathing so fast? Well, special sensors in his body detect those falling oxygen levels in his blood. His brain gets the signal and responds immediately with an override command: breathe faster. Michael's respiratory rate shoots way up. He doesn't consciously choose to do this. His brain chooses it for him. Every faster, shallower breath is his body's desperate, automatic attempt to compensate for those flooded air sacs. And then comes that relentless, hacking cough. Michael starts coughing repeatedly, bringing up thick sputum. But remember, the cough itself isn't the disease. It's actually a highly evolved defense mechanism. His lungs are physically trying to shovel the mucus, the inflammatory fluid, and the dead bodies of bacteria and immune cells right out of the battlefield. When that sputum becomes yellow, green, or even rust-colored, you're actually seeing the massive immune response rather than just the bacteria themselves. So what about the fever? Why does that happen? Because this infection isn't just confined to the lungs anymore. Those inflammatory chemical messengers from the battlefield seep into the bloodstream and travel all the way up to the hypothalamus in the brain. The body's thermostat is suddenly cranked up. Michael feels freezing cold and starts shivering, not because he's actually losing heat, but because his body is actively trying to generate way more of it. It is literally trying to cook the invaders alive. Hours later, his temperature spikes and a severe fever sets in. For a lot of folks, every single breath becomes absolute agony. Why does breathing hurt so much? Because sometimes pneumonia spreads to the pleura, which is that ultra-thin, super delicate lining wrapped around the outside of the lungs. When that tissue gets inflamed, every single time Michael takes a deep breath, it stretches that raw, angry lining. The result is this sharp, stabbing chest pain that makes him want to just stop breathing altogether. Section 3, the turning point. The terrifying moment where the body's defenses are pushed to the brink and overwhelmed. If this goes unchecked, the localized battle hits a horrifying climax. In severe cases, the infection literally spills out of the lungs and directly into the bloodstream. The immune system triggers a massive, widespread alarm. Blood pressure plummets, cutting off oxygen to the brain, the kidneys, the liver. This is sepsis. The body is no longer just fighting a battle in the chest. The microscopic war has spread everywhere, and it is now an entirely life-threatening emergency. Thankfully, Michael makes it to the hospital, and external reinforcements finally arrive. Since bacteria are causing his pneumonia, doctors hit him with antibiotics. Now, antibiotics don't magically repair the lung tissue themselves. What they do is kill the bacteria, halting the enemy advance in its tracks. Once those bacteria are eliminated, the immune system can finally stop fighting and shift gears into cleanup mode. The macrophages sweep back in to clear out the dead cells, the fluid is slowly reabsorbed, and those incredibly precious, healthy alveoli finally start to reopen. Gas exchange starts to improve, but man, healing takes incredible patience. Usually, over the course of a few days, the fever breaks, but it can take weeks for that violent cough to truly ease up, and it might be months before normal lung function fully returns. Most patients do recover completely, but rebuilding 300 million microscopic air sacs after a devastating war, that is no small task for the human body. Think about the nurse standing right there at Michael's bedside. When they hear the harsh crackles of fluid through a stethoscope, see a patient breathing rapidly, or notice those falling oxygen numbers on the monitor, they are not just checking off a sterile list of symptoms. They are recognizing an epic story unfolding deep within the lungs, a story of infection, massive inflammation, a desperate immune defense, and the body's relentless, exhausting effort to just keep the oxygen flowing. Which brings us to the really profound takeaway I want to leave you with today. Pneumonia isn't simply an infection. It is a full-blown war for survival. The bacteria invade, and your immune system fiercely responds. But the grand, tragic irony of pneumonia is this. The very fight that destroys the invading germs, the literal fight that ultimately saves your life, produces the wreckage that temporarily robs your lungs of their ability to breathe. Next time you take a clear, deep breath, take just a second to marvel at the microscopic piece that makes it all possible.